1 in 7 healthy adults are at risk for a medical condition due to their genetics. Some individuals carry genetic changes that increase their risk for certain diseases, even without a family history. This test looks at specific genetic changes linked to a higher risk of developing serious health conditions. The genes included in this test were selected by the American College of Medical Genetics based on their medical significance and potential for clinical action. Some examples of conditions included in the screening: BRCA1 and BRCA2, associated with increased risk for breast, ovarian, prostate, and pancreatic cancers. Additionally, cardiovascular disease genes may indicate higher risk of heart-related events, including sudden cardiac death. The test will also look at genetic changes that may impact the way your body processes certain medications. Understanding your genetic risk empowers you and your healthcare team to make informed, personalized medical decisions. It can also provide valuable insight for your family members about their potential health risks. If you choose to proceed, you will receive a cheek swab kit by mail, along with detailed instructions on how to collect your sample, access your results, and explore follow-up options. If the test comes back positive, it means a genetic change called a variant or mutation was identified. If the test comes back negative, it means no mutations were found in the genes tested. It is important to understand that this test does not look at all genes or detect every possible mutation. You may still have a genetic change in a gene that was not included in this test that current technology could not detect, or that is not yet known to be associated with disease. If you feel that you would benefit from a more in-depth genetic evaluation, your provider can place a referral to our medical genetics department. There are important things to consider when deciding to undergo genetic testing. The Genetic Information Non-Discrimination Act, GINA, is a federal law that protects individuals from certain types of discrimination based on genetic information. Specifically, GINA stops health insurers from using genetic information to determine if you qualify for coverage or to change premiums or costs. Additionally, employers with 15 or more employees are not allowed to request or use genetic information when making employment decisions. However, GINA does not protect against genetic discrimination related to elective insurance policies, such as life insurance, long-term care insurance, disability insurance, or cancer-specific policies. It also does not apply to other entities outside of health insurance and employment. Active duty military members are not covered by GINA protections. While the goal of genetic testing is to help you be proactive in your care, it can sometimes feel overwhelming. It is important to keep this in mind when deciding if genetic testing is right for you. Both Ochsner and our reference lab partners follow all HIPAA privacy regulations, including limiting access to your genetic information. Ochsner Health takes an innovative approach to personalize your care based on your unique combination of genes, environment, and lifestyle. We offer the only dedicated precision medicine team in the region. Our team works closely with physicians, genetic counselors, and other specialists across the health system, making this cutting-edge care more accessible by bringing personalized testing and care options directly to you.